I started in full-time ministry several years ago after a big tragic event that was in my life.
My health problems went downhill at the end of 2015.
My son passed away. He was in addiction, and I threw my medicine away, and I said I'd go out the same way.
My husband worked on the road, and he had a lot of health issues that he had to retire early.
I've had 3 major strokes, several small strokes, 2 open heart surgeries, and a mechanical valve in my heart.
A fiance of mine and myself, we were in a really bad car accident.
So we come home off the road, and of course we lost insurance and everything else.
The whole reality of losing, my son was really hard for me. That depression is something serious.
I lost my job and lost my insurance, so I couldn't pay for my medicines, doctor visits, or anything like that.
She was killed instantly, and it really messed me up. My name's Michael. I'm from Cullman, Alabama.
My name is James. I've been coming to Good Samaritan for 3 years.
My name is Pamela Blythe, and it's been 10 months that I've been coming to the Good Samaritan.
I'm Joyce, and I've been coming to the Samaritan Clinic this is going into my 2nd year.
My wife and I come here for health checkups at the Good Samaritan Clinic on a regular basis, and they have been a huge help to us and to what we do. I got an opportunity to go on tour with a Christian artist. While I was on tour, I started having these really weird dizzy spell things. Like, we're trying to figure out what's going on, and I would go to the emergency room, and I had CAT scans, I had x-rays. It kept on getting worse, my condition. I ended up having full-blown seizures. At that point, we really started going in, trying to figure out what was wrong.
2 weeks ago, they took a carotid artery out of my neck. Thanks to these people here in their caring and loving ways, sent me for the scan of my artery, and it was 90% blocked.
I've had other losses in the family too, my brother and my dad. And so, that was a little bit of a shock for me. And then it was a breaking point, I think, at that time. I held down some really good jobs and tried really hard to do everything that I needed to do to take care of myself and seeing a doctor. Unfortunately, though, I made some bad choices.
I'm a manually labored person, equipment operators or anything like that, so I haven't worked since 2015. An employer is not going to hire me because of my health problems.
With the seizures and with the dizzy spells that I have, every time I go to get one, I have one of those spells, and I can't find a 40-hour-a-week job.
There continues to be a great need for our services in the community. There's still a great number of people who, for whatever reason, find themselves without health insurance and the ability to pay for care.
Unfortunately, a lot of those who do suffer from mental health illness do not have insurance, and they can't afford to pay for a counselor or pay for medications out of their pocket. Steve Griffith was a local attorney here in Cullman County. Unfortunately, on July 17th, 2017, one of Steve's former clients who suffered from mental health issues his entire life went to Steve and his wife's house. Steve was killed that night.
That was a dramatic effect on their family. The family subsequently decided to establish a fund and try to address mental illness for those people who were unable to obtain that because they didn't have insurance or didn't have the funds to do it. While we were raising funds, we were trying to figure out how to reach what the family wanted done with those funds. After talking to Good Samaritan and Jolanda, we realized that they knew it was out there, and this kind of came into a good partnership with Good Samaritan to be the intermediary, and then Haven Counseling to be the counseling service.
The clinic is not here just to provide care to a select few. It's here to provide care for everyone in Cullman who needs it, and it shows in the patient volumes as they continue to increase. We keep data regarding the patient care that goes on here, and we find it better than the national averages, better than our community averages. By providing primary care to the people of Cullman who need it, we're not only preventing diseases that they may otherwise have had, but we're finding diseases in earlier stages where they can be treated.
If it hadn't been for this place, I might not be sitting here doing this.
Since I've been coming to Good Samaritan, the staff has been always super nice.
Everybody has been so kind to us and working with us, even working around our schedule to try to get appointments booked, CAT scans, EKGs, sleep studies, trying to figure out what's going on.
The clinic has been wonderful for me. I have been able to get my medications that I've needed. I have got to go to counseling out at the Haven. That's what really helped me to get to the point to where I could find myself again and get stable enough in my mind and in my thinking to do this thing, to live life on life's terms in a way that I did not have to use a drug or alcohol.
It turned out this is the best thing that's happened to me and my husband. He was on 50 milligrams of heart medication, and this clinic here has got him down to, I think it's like 3.7.
If I don't have the medicines, my heart will quit beating. The valve will quit working. The medicines, if I had to pay out of pocket, would be $1,000 to $1,500 a month.
I think it's a God-ordained situation where God has lined us up with this place because we do a lot of outreach to a lot of young men, a lot of young women, and because of the help of the Good Samaritan Clinic, we've actually been able to continue in doing that, and we've been able to afford it.
Today my life is so much different because I have a whole different outlook on life. Being able to get the nutrition in my body like I needed, and that is with my medications that Good Samaritan has provided for me, was able to get that chemical imbalance that I needed. Mentally, that's what I needed.
They put me on seizure medicine and have suggested different vitamins, stuff that I can take.
Since I've had the surgery, I feel a lot better. I feel like I'm going to be 100% new here.
Good Samaritan Clinic has been a huge component in us being able to do what we do, so we are extremely grateful for that.
All of that has been so life-saving for me in an aspect to where, had I not known, had I not found out about the Good Samaritan, I might not be alive today. I feel that I may have not been able to have picked up.
I would say until the very few recent years, 3 or 4, mental health maybe was not talked about as often as it should be. A lot of people, until this happened with Steve, did not even realize there were these issues out there. So part of the goal is also to bring mental health and mental health issues to the front lines and hopefully make it not so stigmatizing to say that you have a mental health issue, and just to get help to the people who need it.
All of the physicians in Cullman have been very, very grateful to receive the patients that they receive from the clinic, to care for those patients in the same way that they would any other patient that comes through our office doors. And that's what I like most about this clinic. Not only the fact that it's taking care of patients, but it's bringing the medical community here together as well.
Many times people without health insurance are reluctant to seek care, and when they do, many times their conditions are progressed and their diagnosis is not as favorable. So when they have immediate access to care like they do through Good Samaritan, they're able to come in and get the care they need, get their medications, and help them to live that healthy lifestyle.
This is an awesome facility. They have wonderful hearts, and you qualify. If you need help, you need to get it.
If someone doesn't have health insurance, I would suggest for them to come up here because these guys are a savior. And if you need help being referred to a different doctor or anything like that, they'll help you out as well, and that way you can get extra care.
I'm so thankful today that I was able to have enough sense to pick up and ask for help, just to simply ask for help, because I lost that during the tragic events and bad choices that I made in my life. So that was something that I could not do before.
we're able to provide the medical care and access to more specialized services to our patients thanks to the wonderful support that we receive from the community. When people choose to invest in the clinic, they really are investing in the lives of our patients and really making a difference in the well-being of our community.
You just can't express what it means to these patients. They are very grateful for this service. They appreciate the service. They appreciate the Good Samaritan Clinic in Haven. And they have stated over and over again how it has made a world of difference in their lives.
Because of the donors, it's helped me with the medicines that I have. Specialists like the cardiologist and the neurologist, I want to say thank you for that.
I owe a debt of gratitude to this clinic and all they've done to help us. We're very grateful, and hopefully they can continue to get the help and donations and stuff that they need for patients, because they've not only helped us, they've helped a lot of other people too. This is a great place, and I'm thankful.